I've been using this quote from Corey Bush, which says, "Many of us do not choose to become activists. Instead, we are activated." And so, what are some of the things that activated you in your journey?
Ooh, that's a good question. Activated me. I've had so many. It's funny. I was talking to my wife the other day about this. Like when I talk about these different parts within my life and journey that were like pivotal moments on how I came to be. As you can see, Brian Buckley, I'm obsessed with the letter B. And I say that because I think there's this idea of how do we really be into our own story? How do we look at our origin stories? How do you think of ourselves as heroes in this regard? And so I say one of the first pivotal things that has helped activate me has really been my Caribbean background. So I'm a first generation Caribbean American. My mom is from Antigua. My dad is from St. Kitts Nevis, but his parents were from Antigua. So usually Antigua becomes the center of space. And I did a piece a while back ago around how I learned everything about health equity, my Caribbean upbringing. And so, like, for many people, you're hearing, "Oh, Caribbean, that's cool." And I would say often to people, I went to Antigua every year from till I was like 18 for the summer. So, like, you might get sent to summer camp, I got sent to the Caribbean. And the first thought you're thinking, because I know it's the thought everyone else was thinking is like, man, Brian was on the beach, sipping pina coladas, just relaxing. No, that was not my experience. We
No.
were in like rural Antigua where the mosquitoes were biting us up. No AC at the time, and you just had to, and there was nothing to entertain you. It's not like the same technologies that we have here, but it taught me a lot. I had to learn how to just be with myself and be around community.
Mm.
And my grandmother, she was the principal, and she'd have all of her grandchildren come to the house every time my sister and I would come. And we would walk the community and she would introduce us to everyone in the community. And she would have us go out and say to have us introduce ourselves and understand where people's walks of life were. And that was such a pivotal moment. And when I reflect back, I learned a lot of the things around how do you think about community? How do you think about partnership? How do you think about just meeting people where they're at? So I say that was a key pivotal moment from like just the foundation of who I am. And I think as time went on, aspects of college helped shape me a lot because one of those things that for so many people that are listening, some people stay local and some people go out. So I was born and raised Maryland, and so I went to Michigan State, so completely separate from my community, and I knew no one at Michigan State. So it really made me start to reflect on what did I know? How did I present myself? Who do I want to be in this new group of people? And so Michigan State has a very special place in my heart. And one, both activating me and finding my passion for public health and health in general. But I always tell people I was born in Maryland, but I truly became a man in Michigan. And it helped me really shape and build connections. The Michigan culture is so different from the hustle and bustle of the East Coast. And it made me just be in the moment. I learned to enjoy things like camping, going to a brewery, and just having conversations with random people. And so I'd say that'd be the second piece of activation. And then the third, I would say when I went to Massachusetts to go work on my doctorate at Harvard. So I did my doctorate in public health at the Harvard T.H. Chan School of Public Health. And that was a monumental moment because it's like all the things around my Caribbean heritage, learning all the things I learned in Michigan, now coming to this institution where there was a lot of imposter syndrome for myself, being Black with meeting people that were going to be senators and House representatives in the future, have been like leading not for profits across the globe. I remember that moment really helped me lean into who I was and what my superpower was. And it helped really train me to think, okay, I don't need to be like everybody else. I don't need to look at all my mentors and be like, I need to be like you. I need to do what you're doing. But help me lean back, step back and say, hey, Brian, what's your superpower? And how do you be amazingly good at that superpower and your own unique style of leadership? And I said, I think that's really where it made me who I am to Dr. Buckley today throughout all those pivotal moments within my life.
Now, a couple of things. I felt like you mentioned some of those earlier experiences where you learned about the importance of community and how to build community. So, how would you describe what your superpower is, and then how that superpower informs your style of leadership and the ways that you connect with folks? And then, if you could go back into when you talked about how that earlier experience helped you learn the importance of community, say a little bit more about some of those learnings and the significance of building community.
Yeah, for sure. My superpower today, I would say, is being a connector. And so often when I'm talking to so many people, usually say, "Oh, Brian's network. Oh, Brian's a big networker, this and that." And I always tell them I'm not really a networking person because words matter. And usually with networking, it's I'm trying to build something with somebody to get ahead or to get some new skill set. I look at myself as connector. In many ways, I just love people in general, and I think everybody has their own superpower, and I just love to hear people's how what their superpower is and their story. Because throughout my life, when you talk to people, everyone just assumes everyone has a straight line, and they woke up one day and like, I'm gonna be a doctor, or I'm gonna be the CEO of a bank, or something like that. But then you start learning they had a lot of interesting experiences. Where I remember one leader I was talking to, he was like, "Oh, actually, I wanted to be a carpenter." And he's like a major CEO of a big, like, regional bank, and I was like, "That is so different." But he's these are the things I learned from doing carpentry that I've applied today. So I think my superpower is connecting people, and I think when I'm
Mhm.
most happy is when I can connect 2 amazingly dope people together that I heard their story and what they're trying to accomplish and the problem they're trying to solve, and I know this other person's trying to do that, and then connecting them and then just watching the beauty of that relationship happen. I would say definitely a connector for ideas. And I lean a lot into this idea of how do we build community intelligence? Because we all, especially when we talk about health equity, can't be done in isolation. It's not like I'm going to solve anything, but it's us as a collective that have to do that. And so, how do you create bigger value with it, making people have those connections and finding each other? To your second question around some of the lessons learned around community, one, I highlighted it with my kind of connector side of the house. Caribbean people by nature are just very connected people, very pro-social, very community focused. And so my grandmother was really big about community intelligence. And so that's where I think that superpower was starting to get cultivated. Kindness was a really big thing for her. I think when we talk about kindness versus being nice, some people are like, "Oh, don't be a pushover." I can tell you the truth in a kind way. And she really was big
Mm.
about, she was very much an activist herself in her own. She was very deeply, both my grandparents were very deeply involved in politics. And really, hey, our communities are not doing well. Are the roads messed up? Mr. Smith has been complaining about his back for the past 2 weeks, and I haven't seen the nurse go out to him. And she was really big about how she could do her own Gemba walks within the community, get to learn where people are at, what's being impacted. And she would translate a lot of those things to the local nursing station, which would then deploy what services need to be out there. And so I learned a lot of things around kindness from her, around you have to go to the community where people are at. You can't just be in your kind of big tower office and think, oh, I'm going to be doing things around social drivers of health here. I'm going to do equity work here. Unless you're in relationship with people closest to the problem. Because often they have the
Mm.
actual knowledge of how to fix the problem. And I just look at myself as like the translator to translating it to the people that need to hear that message and being the voice when they don't have a voice at that table. And so my grandmother was very big about that. And she is very big about constantly making sure that we are educating ourselves. She would often say, the passport through life is through education. And she's like, it's not just about the formal education of your degrees and your pedigree. She never had any of those fancy degrees. But what she was good at was educating herself on the community, educating herself with the people that matter to her. And so that I would say is some of the lessons that I learned around just idea of community and then community engagement. And I always like to remind everyone that's listening, you are part of public health. You just may not know it yet. You don't have to have an MPH. You don't have to have a DRPH. You don't have to have a PhD. We all have a social responsibility to make the world a better place with whatever skill sets, whatever industry that we're in. And that's how I always say we have to build the tent of public health and making everyone realize that they're part of that journey.